know that nutrition is an integral part of diabetes management. Therefore, nutrition education, counseling and care is recommended for all people living with diabetes and pre-diabetes. In fact, there is nowadays strong evidence that supports the efficacy and cost-effectiveness of nutritional therapy as a core component of quality diabetes care. Access to nutrition education and care means that all people with diabetes globally and at all times have nutrition therapy support from a dietitian or a nutritionist and access to accurate information about food. This is why on World Diabetes Day this year, we join our voices with the International Diabetes Federation to call for greater access to nutrition education and care.
Our roles as dietitians, nutritionists in the care of diabetes is integral to achieving the best possible outcomes for people living with the disease. Strong evidence supports the efficacy and cost-effectiveness of nutrition therapy, but there can't be a one-size-fits-all eating plan because of the broad spectrum of people affected by diabetes and pre-diabetes. Diabetes dietitians are educators, we are lifestyle coaches, and we provide crucial evidence-based guidance to people living with this disease. We support and empower people to make healthy food choices and lead an active lifestyle. We guide people to meet and exceed their personal and medical goals, like improving glycemic targets, achieving weight management, and improving cardiovascular risk factors. We are part of a team of amazing professionals who every day help people navigate their way to a healthy life while fighting this complicated chronic disease.
Digital technologies, particularly the use of mobile apps, have evolved dramatically in recent years, including on nutrition. Meanwhile, an urgent need to find innovative ways to ensure people have access to nutrition education and care has emerged from the healthcare crisis brought by the COVID-19 pandemic. This need is even more urgent for people living with diabetes who need to manage their diet for optimal blood glucose control. The large number of nutrition and diet apps and their numbers of downloads indicate that there is a great interest in diet monitoring and assessment. However, while digital technologies are a promising tool for the future, especially for dietary monitoring, their validity, accuracy, and effectiveness should be evaluated and tested before recommended for use for people with diabetes.
Access to healthy food means that all people with diabetes globally and at all times can enjoy safe and nutritional food that meets their food preferences and individual dietary needs for an active and healthy life. For people living with diabetes, access to healthy food includes daily intake of vegetables and fruits, choosing whole grains in meals, affording low-fat protein foods such as fish, poultry, nuts and legumes, eating healthy fats such as from olive oil, nut and avocado, and less red and processed meat, and accessibility to foods and beverages that are low in sugar, including products with low or no calorie sweeteners to replace some of the sugar in the diet. However, we know that a one-size-fits-all eating plan will not work for all. As dietitians, we are equipped with the knowledge and experience needed to provide an individualized approach considering the person's medical needs and their personal and cultural eating preferences.